Alright guys, I just want to say a little bit about the math regarding using infusion devices, electronic infusion devices, or EIDs or IV pumps, whatever you want to call them. There's not a lot of math involved because typically a provider orders an infusion in milliliters per hour. So they'll say, run the infusion at 200 milliliters per hour. And that means as the nurse, I'm going to go in and hit the buttons 200 start. When you watch the video about using the electronic infusion devices, it'll give you some more information. Please don't get too worried about trying to memorize all the functions of these pumps. You'll get familiar when you start using them in clinicals. You will be using them, I promise you. All of our local hospitals use the same pumps, so this is fantastic. So no matter which one you go to, you'll get a chance to be using the same pump. It's called the Alaris pump. And basically, before I do the math, I'll just let you know there's this main part of the pump here, is what they call it the brain of the pump. And what happens is the pharmacy loads in all of the information about all the different IV fluids and IV medications that are given on a particular type of unit, and it's set just for that unit. So if you're on a med-surg unit, when you turn these on, it's going to ask you, are you on a med-surg unit right now, and you'd hit yes. Because if I'm giving an IV med that lowers someone's blood pressure on a med-surg unit, I can only give a certain dose. In an ICU setting, because the patients are monitored and there's like 1-to-1 or 1-to-2 nursing to patient ratios, the nurses are there and they can see that the patient's blood pressure is dropping really rapidly, they can give a much higher dose. So these brains of these pumps are set with specific parameters, and that's a safety feature for you when you're pressing, I want to give whatever the name of the drug is, and all the drugs are listed in here, and you'll see that when you start using them. These little guys on the side, they're called channels. You can actually have 2 on each side. So you can have up to 4 IV lines going on one pump at any one time. And that's where you set do your pausing, stopping, restarting if it's alarming. You'll see the alarms on here. It tells you what rate is going in here. And on this little screen here, it's like a little scrolling screen where words scroll across it. It'll actually tell you whatever you picked here for whatever IV fluids or IV meds, that's what will show up on this little scrolling bar. So if you picked 0.9% sodium chloride, it's going to show that on the screen, and it's going to show the rate you chose up here, which is kind of cool. All right, so as far as calculations for this, very simple. I'm going to switch over to my little book here. All right, there's a dog watching, just so you know, in case anyone misses Frank. There's Frank over there. All right, okay. It's all about volume over time. So if you remember that, we said volume over time with gravity infusions. With pump infusions or electronic infusion devices, it's volume over time, and it's always hours. Because that's how the pump's set. It's milliliters per hour. All right, so that's what we're going to end with always. So in your guide, I think you had one question, and maybe not, I'm not sure. But I'm going to go over it here. Doctor ordered 3,000 milliliters of D5W over 24 hours. So with volume over time, 3,000 milliliters over 24 hours. I'm going to end in milliliters per hour. So it's already set that way, right? I don't have to cancel anything out, do conversion factors, nothing. So I literally just divide 3,000 by 24. And if my math is right, it's 125. So that's 125 milliliters per hour. All right, another example, doctors order 150 milliliters of NS or normal saline over 2 hours. Again, really simple math here. We don't even have to really do this. 150 mLs over 2 hours. We divide 150 by 2. So we're looking at 75 milliliters per hour. So that's what I'm going to go over to the pump, and actually you'll figure out how you get to setting this, but it would be set to 75, and that's what I would see on the screen here. And then my last example, 100 milliliters per hour continuously. That's a typical example of having fluids run continuously. There is no math. I literally am just setting the pump to 100 milliliters per hour. And it's going to run all day continuously. It's not going to stop after 2 hours or 4 hours. It's going to run all day. All right, so EID Math, super simple. We are keeping it to whole numbers for first semester and second semester. When you get to your upper level semesters, they will teach you to round, like with pediatrics and stuff, to the 10th place. These pumps can do it, but for your first year or first and second semester, make them all whole numbers if you ever have these math problems. All right, that's all I'm saying about this math.